Okay, we're starting with this question. Has the government done a good enough job educating all of us about the COVID-19 vaccine? According to Health Canada, there have been over 115,000 doses administered and only 5 adverse reactions, but even some healthcare workers reportedly are hesitant. So CBC Radio recently spoke with a home care provider who said she's not planning on getting it. So does this government need to do a better job educating people about the vaccine?
Were you
Paul on
surprised when
Facebook
you
wrote
first
us-
heard that the vaccine was ready?
Say it again.
I was.
Were you surprised? Like when you first heard, I think
Yeah.
it was November-ish, end of November, when they were like, the vaccine's ready. Were you surprised?
Totally surprised. They told us it would be so much longer.
Yeah.
Well, normally it is.
Normally, they were saying like 18 months to 4 years at the beginning of the pandemic in North America.
Yeah.
Yeah,
They
but
were.
yay, science. I was surprised, but I was also probably like a lot of people relieved because science is working. So I thought, boy, November was tough because we were leading into the holidays thinking, when is the out for all of this? My question is, because it kind of maybe caught some people by surprise, Lainey, that therein lies the conundrum maybe for some governments, because maybe they didn't anticipate it'd be ready so fast either, and therefore they don't have a public service announcement plan ready to roll out to a perhaps reticent public, especially in the age of anti-vaxxers. So maybe that's why we're caught now with even some healthcare workers saying they don't want to get it. That surprises me more.
Well,
I mean, I thought a lot, though, during this pandemic that the public health advisors need a good PR agent. Like, haven't you been watching them sometimes during press conferences? And like the tone a lot of times is very flat and detached. It's not relatable. And their messaging comes off as kind of like a little bit confusing. I'll just give one quick example. Remember at the beginning how there was this kind of like mask, no mask? It seemed like, okay, we're not supposed to wear masks or they're not as effective. My understanding from reading a New York Times article today is that they actually, public health officials decided, globally, I believe, that they didn't want people to be gobbling up the really, strong ones that are supposed to be reserved for
and 95
obviously
masks.
Yeah, and 95 masks for public health people. So, so they basically kind of bungled that message out when really we know now.
Bungled it. I don't know if
did.
I mean, I don't know if they bungled it in the sense that you're saying, because I don't think it was obviously an intentional bungling. But if you think about the tough place that government officials are in, they have to balance science, psychology, and public health. You guys remember when everything, at least here, and I think in many provinces, everything was announced in 2-week chunks? Why do you think they did that? They didn't say, we are in lockdown for 8 months. Because I think people would have kind of lost it.
I would like to see the government and the media, for that matter, to sort of plaster facts like in digital alerts, billboards, newspapers, facts like the Moderna and Pfizer vaccines being among the best vaccines ever created with like a 95% effectiveness rate. And it makes me wonder if this PSW, this personal service worker, would reconsider getting the vaccine. As a single case study, she suggests that maybe, we're not getting through, that we haven't done enough to get through vaccine education. Her job is literally to care for some of society's most vulnerable people in their homes. And what gets me is that she even acknowledged that, oh yeah, I got the flu vaccine when I was in school and doing my placement, and I never got sick. Well, no kidding. Plus, like, why wouldn't it just follow them that you get the vaccine because this is your job, and your job is to keep people safe. The vaccine is not only to protect you, it's to protect other people against you. Where's the disconnect?
I think the disconnect is like in terms of how, like if you tell the story of COVID-19, COVID-19 was lying in wait at the end of 2019 and made its debut around the world in 2020. We were introduced to this character, so to speak, right? A splashy red carpet, devastating rollout. When, like, you think about it, and I've actually done some reading because I was curious about the vaccines, coronaviruses have been around for a long time. COVID-19 is not the first coronavirus. So scientists have actually been studying coronaviruses for years, which is in part why
SARS is a coronavirus.
There you go.
Right? And that was
there you go. And exactly, Mel. So it's been years since for this vaccine to be in development, meaning that the foundation of this vaccine's development was in place prior to the premiere of COVID-19 in 2020, late 2019. I don't think, though, that in terms of the media telling this story, that's the story we got.
It needs a Lifetime movie.
Right?
That's the thing. Yeah, it needs a Lifetime movie. The explainer is it. This is the problem now, because like there's enough science deniers and anti-vaxxers out there. But I also think that maybe the governments were caught on their heels and not prepared. They just maybe assumed that in the darkness of lockdown that people would just be like, oh, vaccine. Oh, thank God, we're all just going to take it. But in the States, there's one hospital in Oakland, only 40% of the healthcare workers, 40% of 600 voluntarily signed up to get the vaccine for a hospital. And so now they are paying $300 to $500 to their own people to convince them to take the vaccine. I don't know how that engenders trust for the rest of the population. I get it. America's a little different, but we have a science problem and we have a communication/PR problem, to your point.
Yeah, but Mel, imagine if you're a frontline worker, right? Like in the US and in Canada, and remember they were out of PPE and they didn't know how to manage the situation. Like of course, healthcare workers I believe should be vaccinated and should trust science. But at the same time, they've also been let down by the people who were supposed to be taking care of them. So it's really hard to, if you're them, especially in the US, right? Those healthcare workers, remember them posting videos of them like, MacGyvering their own masks and doing their own thing. Like, I feel for them for sure. The trust has eroded.
But don't you feel like most of the people want this vaccine and they want it fast?
Yep.
I mean, yes, but I mean, I do know some people who are actually like pregnant and or breastfeeding and are a bit hesitant because the fact is they haven't really tested that. And again, we talk about the responsibility of healthcare workers and healthcare leaders in particular for communicating the efficacy of this vaccine. I don't think it's still answering that problem for that group necessarily. Although I did see one headline, and this is where the media comes into responsibility too. One headline did say that healthcare providers are saying that the effects of coronavirus are far worse than anything that the vaccine could do to a pregnant or a breastfeeding woman. But we need more. Like that needs to be louder. Mm-hmm. It's like this glass is always half empty with the reporting on this and with the communication on this.
Let's leave. But okay, so for pregnant and breastfeeding women, they still haven't been tested. There is testing going on both with Moderna and Pfizer, but so far they're saying we haven't tested it on pregnant women and breastfeeding women. So there's that. There's also the kid question. They haven't tested it on kids. You know why? They can't find enough kids. They need 3,000 kids to do a healthy trial. They've got about 800. I think I can't remember if that's the Pfizer or the Moderna. So listen, there is a communication problem. There's a lot of unknowns, and whose responsibility is it to fill in the blanks?
Let's leave the last word to Paul on Facebook, who outlines another problem. He says, can you educate people common sense? If people do not realize the vaccine is vital based on worldwide death tolls, then nothing is going to convince them to think rationally and do the right thing. Thanks for that, Paul.
Nice.